A while back, a parent reached out to me regarding one of the daughters. According to her, anytime she gives her an instruction, the child does the exact opposite of what she says. And I said, "Madam, on a good day, does your child know what is right to do without you instructing her?" She said yes. For example, when she eats, if I don't talk, she knows that she's expected to take her plate to the kitchen. But if I insist after she eats and I said, "Young lady, take those plates to the kitchen," then she can decide to take that plate and dump it on her bed in the room. And she said that sometimes I consider that she's dumb or she's deaf. And I said, well, not necessarily, because that is one of the symptoms of children with auditory processing disorder. So if you tell your child to do something, he or she may do the exact opposite. And that's because the part of the brain that is responsible for processing words that filter into the ears, that part of the brain has been tampered with. Okay, it could be from birth, it could be from an accident, maybe she hits the head on the wall and so there's a shift or there's a crack or something in the brain. But these can still be managed and it can be corrected through intervention. So I usually encourage parents not to use some very harsh words, in fact not to use some derogatory statements on their children, and that's because you don't know what psychological effects that your words will have on that child. Okay, that's in addition to the disability, the learning disability he or she already has. So if you see this symptom in your child, please reach out to an audiologist today so that you can take the child for testing, and then if you need to be referred to a pediatric neurologist, then they can check the brain and the functions of the child just so you can rule out any issue of neurological dysfunction. And then the audiologist will begin to work on the auditory intervention for that child.